So, Mark, it's Glenn Gormley again. If I've assimilated what we've talked about this morning, we said we want a system that has all the data in it. It isn't missing some systematic piece so that we don't have a bias, which means we need the healthcare providers and the pharmaceutical industry to be able to provide the data. We want to have the trust of the public, which means we don't want to filter communication, but we don't want to mislead anyone by communicating too soon. And we need to set up a system that has a research objective that's open to everyone to be able to work with, while at the same time meeting the public needs. Boy, that's a lot to put together. And someday we're going to do that, but my guess is we're going to have to make trade-offs to get started. Who and how will we make the trade-offs necessary to get version 1.0 up and running, integrating all of the great perspectives that have been brought to the table today?
Actually,
that's a question to you, Mark, by the way.
Well, if you all want to answer, that's fine too. But that is a nice transition to the wrap up for this session. And before I did that, I wanted to recognize one more speaker at the back. I know you can, but we'll give you a microphone anyway.
I couldn't let the moment pass because I really feel compelled to emphasize the importance of what's being discussed as it relates to trust and communications. And from that perspective, I want to underscore what was said at the very beginning of this session this morning. Part of that establishment of trust with regard to a patient and a physician, and I'll speak from that perspective as a physician, is that that patient has to always know that what you're doing is for them, that they are the end and not the means to an end, either the means to me making my payment on my next BMW or writing my next paper so that I can become famous, that what we're about is doing something that's for them. This initiative has to be always framed in that context. I said this morning, FDA is not doing this because Congress told us to. We're doing this, and someone else said, we're doing this because this is a public health issue in a public health context. And so whether we're talking about the science or whether we're talking about the research or whether we're talking about gaining new knowledge for a variety of purposes, et cetera, FDA will always be approaching this from the perspective that this is being done to serve patients. To be able to make certain that their health is being protected and promoted by the information that's being gleaned and gained from this initiative. And I just didn't want to let that moment pass without underscoring that message. Thank you.
Yeah, thanks very much. That's a great comment to wrap up on. And with that goal in mind, I think many of you or all of you have heard today the word transformation's been said a number of times. And transformations in the patient's interest are something that we hear about a lot, talk about a lot. Hopefully what's come out of this discussion today is that there is potentially a real path to get there, but also, to Glenn's point, that these kinds of changes don't come easily. They don't come without obstacles, and they don't come without many barriers and challenges that need to be overcome. Our main purpose in holding this meeting today was to try to get as many of those out on the surface and up for discussion as possible. And I think if we've had a meeting where the discussions range from the concepts of distributed data networks all the way over to complex data analysis and methods and on to 20th century art and reality TV, I think we've done a pretty good job of raising a number of issues, but also hopefully creating the kind of community. I think Janet called it a social network, not a social network around a reality TV show or Facebook or something like that, but a social network around the next generation and what could be a transformation in how evidence is developed and used to improve not just the safety of drugs, but improve the safe and effective use of medical treatments. This has been a start to that process. It's one element in a larger process that FDA is conducting now as they really try to take advantage of this unique set of opportunities at this time in our nation's history history. It will not be the last step. We intend at Brookings to continue to build on the efforts today. We will have some further meetings and some papers on some of the topics discussed today. This kind of framework for how post-market evidence can be better developed, some of the governance and infrastructure issues, the new data and methods, the legal and privacy issues, communications issues, and impacting patients' lives positively, having a positive impact on practice. We aren't going to be the only ones doing this, and you heard from a lot of other groups that will be continuing activities as well. But I do think that by working together, we can make sure that we take advantage of these opportunities as effectively as possible. With that in mind, I want to thank you for your input today and also highlight that we will be seeking more input in these further activities, and just end up with a special thanks to all of our panelists as well as the people on the staff at the Engelberg Center that made this possible. That starts with Christina Lowell, who those of you probably recognize, and she's going to have I think have her baby like tomorrow or something. And I know you've heard this joke a dozen times, but I think the middle name is going to be Sentinel or something like that. Also, Justin Shore, Teresa Wheatley, Marissa Morrison, Jenny Liljeberg, Emily Wheeler, who did a tremendous amount of logistical work and support work for this meeting, Gary Carr, who helped with the press, Larry Kokot, who does everything, and everyone who hosted us here at the University Club. But most of all, thanks to all of you. There clearly is a strong level of commitment to doing a fundamentally better job with these opportunities we have to improve post-market evidence, and I hope that we'll continue to be able to work together to make that happen for the benefit of patients. Thank you all very much.